Well, I feel like we need to have a round of applause for you guys for coming out. Thank you so much again. The weather has been a little unpredictable all day long. I heard somebody say they had 4 inches of rain. So I was a little nervous about what was going to happen with people coming to back to Shakopee here to my hometown and the district that I represent. So for those anybody wondering, why are we coming to Shakopee? Well, that's why. This is my district, and I appreciate you guys coming out because as a lot of you know, and of course the people watching don't know this, but after we wrapped up that first town hall about a month ago, the energy was incredibly high, and people were saying, we have to do it again. That there's so many more stories that weren't told that people wanted to be able to tell. So we've been talking about this for about a month now. And thankfully, well, not thankfully, but unfortunately, after President Biden came out with his national mandate, we realized, yeah, we have to do this again. So you guys have the stories. You guys are the main characters, and of course the people watching are the audience here. So this is all about you guys tonight once again. And I'm just going to try to facilitate things and try to ask you guys some probing questions and try to get you to come out with what's actually happening in the hospitals you work in. So with that, I thought what we should probably do is start off just like last time and just kind of do some show of hands questions and ease into the night, since about half the people here were not here a month ago. So let's just kind of do this again. We'll do it real quick again. Let's go with nurses in the room. Raise of hand. Yeah, so mostly nurses. I think we have some emergency response people. Did anybody come out? We had some firefighters. Awesome. Okay. I don't even know what else to ask because I really don't know what everybody does. But shout it out. What other professions are here? A pharmacist. Okay, great. Okay. Occupational therapist. Okay, great. Then what's your guys' business again?
Home care.
Home health care. Yes, that's right. Okay, great. Lab tech. Okay. Ooh, I want to talk to you afterwards. What was that?
Surgical technologist.
Oh, okay, great. Well, let's do this then. Let's kind of show what amongst ourselves and the people watching experience level. Let's say more than 5 years in your field. Raise your hands. Okay, that's pretty much everybody. So how about more than 10 years? Okay, we should just up the ante here. 15 and 20? I think I capped at 20 last time. 25? Yeah. Wow, okay. I won't go any higher than that for you guys. Great, well, so I think this is important. Who has worked directly with COVID patients? A show of hands. Okay, nearly, well, what is that? 75, 80% probably? Okay, so that's huge, because that's obviously at the nucleus of what we're talking about. And then I wanted to ask this, and I don't know what to expect, but show of hands, who sees this forced vaccinations as some sort of partisan issue, Republicans versus Democrats, duking it out? Right, that's what I figured too. Like, this is not a partisan issue at all, and I'm shocked at how in some places it seems to be made into one, but it's really not. This is not red team versus blue team. Okay, and I'm glad to see you guys agree with that. All right, well, I'll answer this first question, or I asked this first question. With the mandates looming, I'm curious, and I'm sure people watching this are curious, what is the work environment like in your hospital or your work setting right now? And just, again, shoot your hand up and we'll get microphones around.
So right now, thankfully, I primarily work from home, but the bullying I've heard from other vaccinated people or even doctors, other nurses, it's tense. I mean, even from patients, even calling. I don't understand why everybody isn't just vaccinated. Just go and do it already. Well, obviously, they don't know I'm not, but it's depressing, it's stressful, and it's hard. I mean, being told that you're no longer a leader in your field and hearing other nurses going home from work and they're just belittled by so many people. It's terrible.
Who accuses you of not being a leader in your field? Where does that come from?
Doctors.
Doctors, okay. I've heard that. I was curious if that was going to be the answer, but that's what I've heard.
So I work in surgery, and we have a couple of issues, and I think I brought this up at the last meeting, but it's gotten worse tenfold. We'll have patients come in, and we have patients that aren't vaccinated, and it's gone from the chatter in the room of, well, they would be up here already if we knew their vaccination status instead of having to wait for a COVID test. But now we actually have had patients that are refusing blood transfusions because we can't guarantee it won't come from a vaccinated person, and they don't want those antibodies. And the conversation in the room has turned to, we should have just let them sit in the emergency room and die. And there's actually nurses being written up and being turned into the nursing board for those comments. And then those of us who aren't vaccinated, it's getting to the point now where people know who is and isn't vaccinated. And when you're walking down the hallway at work, the vaccinated will look at you and they'll move to the other side of the hallway like you're a leper. It's getting ridiculous. It's yeah.
One of the things, I can't remember if we brought this up during the town hall or if it's somebody brought up afterwards, but somebody said to me that the unvaccinated staff are being forced to wear like a pin or a star or...
The opposite. So if you're vaccinated,
Oh.
you have these cute little tags, like what you see on a meter for your house, the electrical meter.
Oh, yeah.
They're these cute little tags, and like a blue one is for COVID and the white is for flu. And if you don't have it, that means you're not vaccinated. So people are walking around and they look at your badge, and then they give you one of these looks, and they go to the other side of the hallway, and it's like, seriously?
It just reminds me, I'm sorry, maybe I'm alone here, but I have kids. I'm sure lots of you have kids. It reminds me of Sneetches, the Dr. Seuss book, the Sneetches with stars upon bars, like that is.
Wait, Dr. Seuss is banned.
Oh, that's right, Doc, yeah, he's not good.
At our hospital, it's a little bit different. I'm in a small community hospital, and the toxicity is more administration against staff. Apparently, administration didn't get any input from the directors, the nursing directors, didn't get any input from the staff before they made this mandate. They just did it unilaterally without getting the buy-in or even feedback from. So it's more, the staff aren't mad at each other because we're a small facility. We really all have to work together. So when they know they're losing valuable, very experienced, top-notch nurses that they have worked with for years and years and years, and sometimes decades, and they're losing them because of an administration mandate to get vaccinated when they've been working side by side for 18 months, plus it's really turned more against administration, and it's more like a simmering boil under the surface because nobody wants to get fired for talking down about administration policies and that, but it's not good. And I have heard that as many as 40% of our anesthesiology staff will be walking, which would kill our hospital.
Right, well, I want to ask about that later too, but it feels like, I've heard some people describe it as like this giant game of chicken, who's going to blink first? Is it administration, is it staff? And
Right now where I work at, and some of the other people here do work at, we get emails constantly. One of the physicians said we're in the wrong field if we don't get vaccinated. For myself, I worked COVID. For a lot of the rest of us, we did too. I'm in the right field, it's just I choose not to get a vaccination. But there's other bullying constantly. The buttons saying that vaccinated, I have a friend that's vaccinated, and she said that they were told they had to wear it in our building.
That's interesting.
Thanks. It's a hostile environment at the hospital that I work in. Not for most, but for me, because I'm one of the few that is not gabbing all the time about vaccination that, vaccination this, and actually making up stories about the population of, I work on the COVID floor at the hospital, and doctors and nurses are talking about how all of the current COVID patients, which the floor is full of new COVID patients, are unvaccinated, is what they're saying, and the actual opposite is true and written in their charts.
Really? So they are
Yes.
vaccinated, and it says on their charts they're vaccinated, but the message they're pushing is they're unvaccinated people.
Exactly.
Really? And
And-
everybody's nodding their head to this.
The most shocking thing that I have heard, besides just laughing in my face when asked if I was going to get the vaccine, and I said no, and explained my reasons why not. My coworkers laughing in my face, name calling, those types of things, talking behind my back, being quiet as soon as I walk into the area, saying, things like, just get the vaccine or get out, with that type of a tone of voice. Very offensive. But they also have been lately saying, several nurses and doctors, I'm having such a hard time having any compassion or empathy for these patients that have not chosen not to be vaccinated, and here they are sick. I can barely take care of them, which is so wrong.
I mean, that just, so I don't share this with people, although I've told you guys, I think a lot of you, but I have a surgery coming up in 2 weeks. And this makes me want to bring a little secret audio recording device and just record and see what people say. Yeah? Okay. I will do it. Where am I going to put it? Yeah, I might be crafty. Yeah, okay. Well, let's move on a little bit here. Do you guys want to respond to that question? Obviously, this is like...
I do.
Oh, sure.
I have firsthand experience with the bullying. I was recently suspended. I had a patient that I was talking with in the COVID unit who had COVID. Right on the front of their charts, when you open them, it says whether they're vaccinated or not. I was told that in my conversation, I initiated with her. I started the conversation. I have no recollection of this. But at any rate, the family reported me because they said I influenced the patient by my opinions, and so therefore I had to be suspended without pay. I have been under the same circumstances as she has with the bullying. I have been told by several of the immediate group that I work with that I should just get the vaccine and stop whining. Many people have gotten it, and you're looking at them, they're okay. I've heard, and I actually have a post on my Facebook where one of our doctors in our facility posted that she is very overwhelmed with the COVID patients and is losing her empathy to take care of them. As well as my own boss then reposted that same thing. I've heard ER doctors say things about not taking care of patients because they shouldn't even bother to come in if they have COVID and they're not taking the vaccine.
Doesn't that, I mean, I see this argument all the time. I mean, if anybody's on social media, you see that argument. But to me, it's the equivalent of saying if you don't wear your seatbelt and you get in a car accident, then you suddenly just don't deserve medical attention. It makes no sense.
Or a smoker doesn't deserve care.
Right.
Or somebody who's overweight doesn't deserve care. This is insane.
Alcoholic,
Yeah,
drug
This
user.
We signed up to take care of people. That's what we do.
Right.
And there should be no talk of why the patient's there.
Well, I'll move on to the next question. But again, I mean, this is your night, so you can ignore my questions, and you can answer that last question. So when you talk about what happens with healthcare, right? You talk about people that are going to be leaving, 40% of anesthesiologists. So as you guys are in this world and you project out, what does healthcare look like in a year or 2 years or 5 years from now? If no one stops these mandates, what does it look like? What does it look like in communities across Minnesota? The access to care, the quality? I mean, I'm curious what you guys' thoughts are.
I think that this is a great question following up from the bullying, because you can see what kind of staff are staying. You know, the issue is with the mandates, there's going to be people who leave. You know, they said anesthesia in one area 40%. We've seen lots of places that have high percentage of staff leaving, and so obviously the access to care is down that way. But once the mandate's done, those staff will leave, but then we're already short-staffed. They're going to be even more short-staffed when those staff leave. It's not sustainable. You can't work in those conditions when you're that short-staffed, and the empathy they're losing now is just gonna get worse and worse. And the thing is that you can see all these people here as we're explaining our stories. We're people for choice because we understand that as a healthcare professional, we aren't here to judge. We're here to care for people just like they were our friends or our family. And so those are the staff you're losing. You're losing the staff that would advocate for their patients, even if that choice was not the choice they would have made. And so that's a really big deal for the community to know that you're going to be going to receive care from people who think they know better than you do about your own health choices and about the choices of your children.
Wow, yeah, I had never thought about it like that. That is such an interesting point. I had never thought about it like that. Go ahead.
So, yeah, in terms of the bullying, with all this hostility in the workplace, and then the talk about the patients, how they feel about their lack of empathy. I mean, if you did that any other time before this, you would get disciplined up to termination. And so now they're
Really?
doing all of this talk, and they're putting it out there in the public even. And it's like, that is so, so unethical to, you know, I mean, if anybody would have done that pre-COVID, saying, oh, I just don't know if I can take care of patients anymore, or I'm losing my mind, or I'm losing empathy, or whatever, we'd get in trouble. And now everybody's just doing it like it's no big deal.
Huh.
I mean, this is not good.
They're ganging up to do it.
Yeah.
Together.
Absolutely. Yeah.
Interesting. I mean, I guess that makes sense. If you're going to deny people care, even talk about it, then there's got to be consequences. But that's crazy.
I described it once as being like in a really bad abusive relationship. It's everywhere. It's social media, coworkers ignoring you because you're not vaccinated, or bullying you, and they make us feel like we're the crazy ones. We get constant emails every day from this leader got it, and oh, everything's just fine. Oh, she was pregnant and got it. Everything was just fine. You guys just need to buckle up and get your vaccination. And, you know, you drill it every day about how crazy we are, because we are for choice and not for vaccination.
Well, I would add to that, because I mean, what I've seen in the political realm, and just you kind of just swap out the issues, there's a constant push to make people feel like you are the only one who thinks like that, and that you're nuts for thinking that. And I think that's part of the reason I think this is powerful, and why we wanted to do this in person again, because to show that there's 40 people that showed up and drove in crazy weather to get here, that you're not alone, like you're just not. And I think, you know, there's that Facebook group, Rally for V-Choice, that's within weeks has like 50,000, you're probably all members here. You know exactly what I'm talking about. I mean, you're not alone, and I think that's huge to keep in mind. I've lost track.
I work in a different atmosphere. I work in long-term care, and I was on our COVID unit there as well. Our facility is currently not mandated, but it's coming. As of today, we were notified unvaccinated will be tested twice weekly. It's coming. We know that. I took a moment and looked through my roster on my list to see who was Medicaid and Medicare, and on my unit, which is the locked unit, there was one who was private pay. So it's inevitable. The owners are not pro-mandate. They have been at the Capitol. They've been holding signs and standing with us. So we're grateful for that at our work. There are 2/3 of our staff who are against the vaccinations and will be gone.
Really?
And that includes administration.
Wow, 2/3. I'm kind of curious if you guys are willing to shout it out. Like, if you had a guess, 'cause you're in there, you know what percent of the staff in your workplace is against the mandates, and maybe they've even been vaccinated, but they just don't think that it should be forced upon people. Like, if you shout it out, like 40%?
Yeah.
Everybody's kind of shaking. 10%. That's much smaller. Well, that's how you feel. Oh, I wonder what it's actually.
No one's talking about it because we're so shunned.
Yeah.
We're whispering to each other.
Yeah, I forgot I heard that 20 to 30%, 40%, and 65%. That's a big number.
Every day there's more people at work that will come up to me because they know that I'm fighting for this. Andy, what are you going to do? Is there anything you can do to help me? Can you help me write my exemption? You fight so hard, we've seen your videos. What can you do to help me? I'm at a loss, you know? And so every day there's 2-3 people more. So you figure since our last meeting, working 5 days a week, you know, that's 20 more people each day, at least 20 people since then that have come up to me, and that's just in the operating room alone. and right now, we've shut down even more ORs. So last time I was at the meeting, we went from 19 rooms to 17, now we're down to 15 and 13 rooms. Because
Wow.
we don't have the staff. And I'm leaving, and when I went and told my boss on Friday, I put my notice in, he just looked at me and shook his head. He goes, I don't know what we're gonna do.
Yeah.
And my recruiters that I'm talking to, they said, we don't have enough nurses. And she goes, this is just nurses. This isn't surgical techs. This isn't PAs or MPs. Nurses alone, there is over a 50,000 nurse shortage in the United States right now to meet demand.
So let's bring that back to what happens to the ability to get care, because I think that hits home for people, right?
I think people are going to be dying in the ER with heart attacks and strokes because they're not going to be able to get the care.
So I talked to a nurse on the way in today, and I was asking about this whole bed shortage. I mean, that's the way it gets teed up, is there's a bed shortage. And she said, no, there is tons of beds, but we have a staff shortage. We can't staff the beds. And that's, so if 40% of people are leaving the systems, I figure out where to go, stop the feedback, then that only, it exacerbates the issue, right? And so if you, I don't know if anybody's willing to speculate on that, but, I live in Shakopee here, we have St. Francis down the road, and typically you go into the ER and it's pretty quick, but what are wait times gonna be like? Like what?
We have 5 and 6 hour wait times right now.
Oh, really? Somebody,
We are at 18 hours from ER.
oh, okay, we gotta get this microphone shooting around then. What was that?
We're at like 18 hours some days, some weekends especially. We can't get people to pick up. Bonuses are really nothing and for how they're acting about everything. Fortunately, the floor I work on is very cohesive. So even the people who are vaccinated are ticked off. Now, with the exception of a few, there's always going to be the exception of a few, and they're so afraid of us unvaccinated, but they eat from all the potlucks that we bring. So,
Of course.
I mean,
Just like the Emmys last night. Nobody cares, we're rich and famous.
yes.
Yeah.
So, never in the history of potlucks have I seen any of them skip them, whether it's brought in by a vaccinated or an unvaccinated person. But our wait times are crazy. I work charge almost every shift I'm there, and I close our unit with 8 open cardiac beds. Our unit only has 24 beds, and cardiac beds are usually in high demand. And I'm like, I don't know what to tell you. We have no nurses.
So let's keep moving the mic around. If you guys can then stand up if you're going to speak, if you're behind this front row, so we can see you. I'm kind of curious. Access to care, to quality of care. That was such a unique perspective about the type of people that are going to be left to care.
So I'm not a nurse, but I just want to say thank you so much for all the work that you do. I'm a teacher. The reason I'm here is because I had a vaccine side effect. I had 1 dose of Moderna back in February, and it's taken me 7 months to get better. I'm still not better. I had a whole bunch of things, including heart damage. I just had an echocardiogram on Wednesday. To be fair, I'm a pretty sensitive person, and I almost didn't go get my vaccine. I found out from my brother-in-law that he was worried that I was going to get it, but he didn't tell me that. As it stands today, if I wanted to say that I was sensitive to things like meds, I wouldn't be able to, mandates going forward, no. Which is why I'm totally against them. I've met a lot of really vaccine-injured persons now from this particular. Now, I've had all of my childhood vaccines, all of my kids have too, but I know full well that we don't have long-term data on this, and it's all still in clinical trials, even though it was approved. So we don't have all the data. I know that, and I've met a lot of people, and I've looked at VAERS, and I've looked at things, so I know that there's legitimate concerns for people to want to not, COVID is a serious illness, but it's ridiculous to pre-harm people or put them at risk for example, I have continuous atrial fibrillation. And we're going to go forward and work on that. But that is, if anybody knows, is a risk factor in COVID. So in fact, I was given a risk factor, which is insane. So anyway, I just wanted to share that. You know, I know several other people. There was a lady who was going to come tonight, but she didn't feel well enough, and she used to jog, and she's in a walker. She was going to come with me, but she didn't feel good. So anyway, my name's Kate, and I live in New Brighton. Thanks.
Thank you for sharing that. You better say something.
I think that's just part of the misconception is your stories and all of the others that are injured are hidden. The second you post anything anywhere, it is taken down. And I have heard from 4 people in the past week who have been injured by the vaccine. One is in the ICU within the last week.
Wow.
And they're not patients, they're friends, they're family. One's in the ICU, one is home, but struggling. Stroke, amnesia, everything, which is amazing. A side effect, I had listed all the side effects today, going through VAERS and amnesia. I mean, some of them are, you know, your typical COVID symptoms, but then there's all these other symptoms that, as I said the last time, I've never seen symptoms from a vaccination that way.
I got to ask you guys a question. So I watched this video, and it was a nurse. She was opening a box of some COVID-19 vaccine. And she said, this unopened box. So she opens this thing up, and she pulls out this pamphlet, and she says, this is the information that all medicine is supposed to have. And she unravels this thing, and it's this giant piece of empty paper. Like, that's real? And that's very different from other medications. Oh, my gosh. Right, yeah, normally there's actually information on the information packet. Okay, that you would think so. Wow.
So this is slightly different, but it's a good time to transition to this topic, I think, because I have a feeling with the VAERS reporting, I never can remember the exact abbreviation with that, but I feel like a lot of people are not doing it or don't even know. In this past week, I work in acute care in occupational therapy. And this past week, I reported 4 different VAERS reports because 3 of them had gotten the COVID vaccines and were there with COVID. And there was one that just broke my heart last week. He was a gentleman, young in his 40s, very, very healthy background, like no prior medical history whatsoever. Active, independent, working, has kids, ended up in the hospital, could barely move either arm, barely move either leg for mobility. The doctor's diagnosed with Guillain-Barré syndrome, and I'm like, you've got to be kidding me. I mean, I was almost in tears when I left his room. And I'm normally, as a medical professional, I'm sensitive, but you know, I can separate my own emotions from it. And I walked up to the doctor, I saw at the nursing station, I go, do you think this has to do with the COVID vaccines he got? He's like, oh no, he had respiratory issues this last 3 months, and it's because of that. And I kind of let it go at that, because I was just trying to build that confidence to even ask the doctor on this one. So I went ahead and filed my VAERS report, I'm proud to say. But,
all right.
But he just really hit the heart. I mean, he barely can move those arms and legs. And I mean, he needs extensive rehab, and I don't know how much he'll get back. I mean, only time will tell. But my gut feeling is it was from the vaccine. And I've done this long enough, my gut's pretty darn accurate from prior experience. So that's just one of many examples, and I've seen other videos and talked to other people who have had a stroke 2 or 3 days after getting the vaccine, or somebody whose brother-in-law passed away because he got the vaccine when he had COVID, but he didn't know he had the mild form of COVID. And they don't test for that before you get the vaccine, so how many other people is this happening to? And the other factors are, you know, all the numbers that come out on CNN, or for the people who are so high on getting the vaccine and thinking the world should have it, their numbers are so incorrect as to how many people are dying from the vaccine, how many people are getting additional health conditions because of the vaccine. They're just in total denial with it.
Yeah, you guys have probably all seen this. Sorry, I didn't mean to cut you off.
No, that's okay. So I get very concerned that not enough reports are being filed to VAERS. And I mean, I asked the doctor and she didn't even know what it was. And I'm just like, oh my goodness.
The doctor didn't know what VAERS was?
No, because it was the first time I had filed and I was trying to figure a little bit of information out. And she's like, what's VAERS? I don't know anything about it. So I asked a couple others and they gave me some answers, but not exactly what I
Trust
wanted.
the experts, though. Unless you have a medical degree, you
Yeah.
don't know what you're talking about.
Yeah,
Liz.
and it's very time consuming. It takes probably 25 minutes, 20 minutes just to do a quick report of it. So I see why a lot of people are avoiding it time-wise. But my God, this is to help save lives. I mean, that's what we do.
Wow. Well, I'm sure you guys have seen this. In fact, I saw it on the Rally for V Choice page. But that ABC request to say, hey, give us some feedback. We're looking for people that were affected by COVID and wish they would have gotten the vaccine sooner. And there were 39,000 last I saw comments, not about people who wish they'd gotten the vaccine, but people who had an adverse reaction to the vaccine. And of course, I doubt they did any stories on that.
So obviously, everybody's being censored if you have a reaction or you have anything negative to say on the vaccine. And with stories like yours and with the 39,000 that replied to the national news media, is there a way that we can start a platform to get people together to start going as groups of 50, 60, 100 people, even if we have to take turns renting a bus and go to the hospitals and sit outside of the hospitals and tell people we're the vaccinated injured, this is what happened to us, listen to our story before you go in, they're censoring everybody, and start pushing back on a different platform. Is there a way that we can organize that?
Yeah, absolutely you can do
I'm
that.
serious. And I'm asking this because I know this is going to be seen by thousands and thousands of people because our last one went nationwide. So is there a way we can start a platform where we can get people together? I mean, I got a truck, I can haul a handful of people, but if we start getting groups of people together, especially when there's going to be a bunch of us unemployed with time on our hands, let's start getting these people together and go hospital to hospital to hospital and show them what's going on. When you've got somebody trembling or can't talk or has no feeling or is in a wheelchair, you can't deny that. You can't censor that when they're there in person. You can't.
Yeah, I mean, of course, the answer to your question is absolutely, and you're right. I think several 100,000 people watch this across the country. I have postcards from Nevada and Tennessee and Texas, so I think that can inspire people to take that type of action, and maybe they come up with another different variant of it, but there's variants. Ooh, that's a bad word.
Red buses, I don't care. If everybody kicks in $25, you can get a bus and fit 100 people on it and go to hospitals and sit out in front on the public street and show people what's happened to you.
Yeah. Well, we can talk about that afterwards because I'd love to help participate in that and help organize it. Sorry, let's get over here. You got the mic?
Yeah, I think the big thing to point out here is that how strong the cognitive dissonance is. Because like you were talking, the ABC thing, the 39,000, I had friends sending to me that they posted on Facebook and their friends on Facebook were saying, I'm so disappointed in you that you're falling for all of these lies. Like 39,000 people had enough time on their hands to just comment firsthand experiences. Like, how can you not? And the doctor is, a person that gets Guillain-Barré. Guillain-Barré is a very well-known side effect of just about every vaccine, some of them more than others. And for the doctor to, not even consider that could be the issue. It's mind-boggling and it's terrifying and it should scare everybody because the VAERS reporting is not happening as it should be. And she, had mentioned that the doctor said that he had never heard of it. I would say that the vast majority of nurses have never heard of VAERS until all of this came about, and then all the fact checkers came out and talked about how VAERS is only, what do they call it? It's not unverified, but as she had mentioned, it takes about 25 minutes at minimum to fill these out. So I would say that if somebody takes the time, despite all of the doctors around them telling them it's not that, you're silly, laughing in their face, calling them anti-vaxxers for even considering it's from the vaccine, took the time to write it up for 25 minutes. Ashley has staff in her ER that sit for hours after work to put in VAERS reports. If they're taking the time to do that, they are very concerned that this could be not correlated, but causative of it. And we're not saying that all of the reports are truly from the vaccine, but they're not even being looked at. They're not even being investigated. It was just like within the last month or so, they had finally did one autopsy on somebody who died after vaccination. They've done one autopsy. The concern is that they don't care right now. They don't care that people are being injured by this, and they want to try to make sure that it gets pushed under the rug as best as possible so that they can get everybody vaccinated.
And it makes a lot of us wonder, why don't they care?
Right.
Why
Where
don't
there's
they?
risk,
What-
there should be choice. Where there's risk, there should be choice, and that is all we're asking.
So let me kind of shift gears a little bit here. I want to try to get through some of these things. But again, ignore my question and say what you want. But there's a lot of misinformation, right? Sorry. Oh,
It's fine. I just want to add to your comment. I happen to know somebody who's trying to get a non-censored platform ready, and it's going to be called youtwitface.com.
you twit face?
Youtwitface.
Yeah.
We will connect after, but I still think
Yeah.
Catchy.
getting people in person to show up.
In person would be great, but just so everybody knows.
Vaccinated deaths are underreported too because you have to be fully vaccinated for 14 days after your second dose to be considered a vaccine death. Exactly.
Interesting. So I want you to repeat that again with the microphone coming up here. Sorry, go ahead.
I do not have myself personally, and this is upsetting. My husband died on July 20th. He was vaccinated. When he died, the coroner came to my house on an unwitnessed death with him laying on the floor and said he didn't need an autopsy because he was overweight, had hypertension, which was treated, and had sleep apnea. He was 46 years old. I was told an autopsy was not needed. If I wanted it, I would have to pay for it. I am beyond disgusted with what is going on here. And I don't care what anybody says. I am not getting this vaccine. And as far as what I said before about my work coming down on me, sorry, but I'm going to say it, to hell with them too. I do not care.
Wow, I'm sorry.
There's a little twist in the topic, but I wanted to talk about the exemptions for the mandates. So in Minnesota, I have I filed for a religious exemption, and the reason being that when I have a big decision to make, I pray about it, and if I don't get a good feeling about it, if I don't feel like, I don't do it. I've learned the hard way, several lessons in my life, that when that still small voice inside me tells me something, I listen, because people can die if I don't listen. I mean, I've had it happen to me in the past. And so, but we have religious exemptions and we have medical exemptions, but we don't have conscientious exemptions. And that's what we really need. We need conscientious exemptions, because there's not everybody has medical, the only reason you can have is if you're allergic to the vaccine, basically. And at my hospital, they denied everybody's religious exemption, and they did it all on a form letter. They're all exactly identical, which is completely wrong.
Yeah, I mean, I think there should be one exemption, that's free will. I don't think we should have anything else. So what about the common misconceptions? You know, the misinformation, you hear this term thrown out all the time. Like, what is the thing that you hear and it drives you crazy and you want to set the record straight?
Hi, I just want to speak to that. I want each of you to ask a question. When in our history has physicians come forward and stated there are effective and safe treatments for this illness, and that has been proven? Ivermectin, hydrochloroquine, quercetin, high volumes of zinc or vitamin C, zinc, budesonide, and they're all being censored, suppressed, and their license are being threatened. So that should be a red flag for anybody. I had COVID, I was hospitalized, I was on oxygen for months after. I was on remdesivir. If you do research on remdesivir, it's by the grace of God I'm standing here today. And the other thing I wanted to mention is natural immunity. It's all about getting the vaccine. There's no exceptions, and there's no scientific, even remotely smart conversations going on. It's just vaccine or nothing, and it's wrong. I firmly believe that this is going to be the downfall and restructuring of our medical community. It needs to be changed. Big Pharma has taken over, the CDC, the FDA, the NIH and the AMA are all completely corrupt and captured operations. Thank you. I just had to say that.
Yeah, what about natural immunity. I don't understand. It's like natural immunity doesn't exist anymore. And that study out of Israel shows it's like 13 times more effective than the vaccine. But it gets ignored.
So I think one of the most striking misconceptions right now is that I think, no doubt, the unvaxxed and the hesitant, we are not part of the majority. That's obvious and clear. But I think the majority, and maybe even the forces that be, have been peddling and have arrived at this misconception that the unvaxxed and the hesitant are just conspiracy theorists or tin hat wearing nut jobs or something. Guess what? If you stop and you put 10 of them in a room and you talk to them, I'll bet you more than half of them know way more about the data, the science, the actual objective facts than half the providers in your city. I analyze data for a living. That's my job. I'm an IT. I happen to work for a healthcare company. I work at home in my basement. I said, they tell me I have to get a vaccine. There are over 200,000 articles in PubMed from the NIH about COVID. That's how much content there is out there. A lot of people like me, they approach this, the hesitant, going, well, I'm not going to go ahead and just take your word for it. Yeah, your credibility based on your authority as a doctor or NIH representative, fine. But I'm going to go ahead and do my own research because it's going in my body. I'm going to think about this. Now, I've done all kinds of that, and let me tell you what, my hesitancy is sufficient enough to make me say, I'd like to see a couple more studies first, please, before me and my kids
Which
are
isn't
going to be
asking
mandated
much,
to do this
right?
kind of thing. You know, so there's another misconception here that is probably significantly more impactful, and it's that you can make nurses out of thin air, because obviously they think that you can. Because why else would they have a mandate that says we're going to just send you to packing to the streets after all these people who are in the medical field, they're data oriented. These are smart, sharp people. Why would you assume that they have no competency to evaluate their own safety for themselves in this medical environment? You're going to throw them on the streets, kick them out the door, and continue providing your services. How? Are you going to get where are you going to go? Pull them in from Canada, from Mexico? Where are you going to get your nurses from? It doesn't make any sense to me. I mean, and my company, I can tell you this, we're already reeling back services, and the deadline's not even here yet. We've lost 2 urgent cares already, meaning they had to redirect the providers from one system to another, just like, you know, they don't have the staff to service the larger systems. They're already starting to roll back certain services. Oh, we can't do level 4 surgeries, the things that can be deferred because we just don't have the staff. They're cutting back certain services and whatnot. And I'd be shocked if my company was the only one in that situation. You know, so what do you think is going to happen after you cross this magical deadline in this game of chicken where you say, nope, you're gone? To the people at home, that's going to be a real rude awakening for the rest of society, because you have no idea how many people are just about to get fired and they're not going to be able to provide blood transfusions for your elderly loved ones. They're not going to be able to meet you at the ERs. They're not going to be able to drive the ambulance to come get you, et cetera, et cetera. This is a very dangerous situation, and this is a dangerous game.
Yeah, well, and you hear a lot of people, especially around campaign season, they go around, they say healthcare is a fundamental human right. Well, I feel like they're starting to take away that right if they really believe that.
Okay, so when you talked about that, how many of you thought maybe, okay, so the new grads that are coming, I don't know how hard the schools are pushing. I think they are pushing, you know, all the new, you know, medical people to get vaccinated. So are they relying on all these new people that have zero experience? Well, I shouldn't say zero. I mean, you do get your clinicals and things, but right, because yeah, it's zero because, you know, it doesn't hit, you know, until you get to your real, you know, first job, you know, that reality. But yeah, how many have you thought of that? Are they going to just rely on the new grads? Or what are they going to do?
And are there that many in school that are just going to suddenly
No,
backfill?
probably not.
Many of the colleges are short students right now.
Yeah,
There's no nursing
so.
students.
Last year, when we were having people
Let's
getting
get the mic around, if you're,
to say last
Uh-oh.
year, we had people getting sick. They were taking nursing students as interns and training them in the ER and training them on the floor to do COVID care because we had so many people out. So I can only imagine right now they're taking students that have no experience, that aren't even licensed, and they're putting them in intern programs to earn credits and just throwing them on the floor to take care of people because we're not there. That's what they're doing to try and compensate. Exactly, they're not even,
That should terrify them.
they're not even licensed.
And lawsuits are going to go.
Yeah, they're saying that should terrify people, and it should. And I've heard from multiple places that nursing programs are down. The enrollment is down. The nursing program I graduated from, when I was there was a waiting list. Now this next cohort that's going through, there's 45 spots. Only 30 of them are filled, and 9 of them quit in the last month and a half. And so people are starting to question even if this is something they want to do. And she had just mentioned too, a lot of these nursing staff that are going to be graduating haven't even had in-person clinicals. They've had clinicals online or simulation, whatever. Right. So it's a whole different level of unqualified. Wow, yeah. In some programs, like the hospital that I used to work at, would have new grad programs. Well, you need experienced, willing staff to train these new grads. And so, yeah, it just is.
When we're talking about experience too, in an emergency room, there's 5 to 7 certifications that you need to have a trauma case or a cardiac arrest or stroke patients. So when you're training somebody, most new grads in an emergency room don't even get to that level to be able to take a STAB patient for a few years.
Oh, wow.
And you're talking, they're already paging out on the daily that they need a STAB trained nurse. Yeah. They're short already, and it
You say
hasn't
they're
even
paging
gotten.
out on the daily. What does that mean?
So saying that they need help.
Okay.
So every day they need help in certain departments. So we get texts saying, hey, can you pick up? Hey, can you pick up? And they're even paging out for STAB trained specific nurses because they are so short already. And STAB is your traumas, your higher level, and you
Okay.
have to have all the certifications to work in that department.
Wow.
The scary patients in the ER.
It's the scary patients.
scary
in the ER.
patients,
But yeah,
alright.
that's the thing is, someone had mentioned about nurses being dispensable. They're just going to get them on a thin air. It's not just a body that went to school to be a nurse. A lot of these people that are leaving are very experienced, certified nurses. They're specialty nurses in their areas. You can't, I work OB. You don't want me taking care of an ICU patient. You don't. But you also don't want that ICU nurse coming and taking care of my patients, of my, high-risk OB patients that are on MEG and Pitocin and, have to watch this strip and make sure that this baby's doing okay. You want highly trained staff in the areas that they're specifically trained for. And
So-
that's not happening already.
So we're talking about an existing staff shortage, right? Somebody said there's 50,000 short in the country, making it worse. And then even if you can backfill, the depth of knowledge is going to get much shallower. And probably the ability to actually provide care, I'm assuming, if they don't have the knowledge to do it. Wow.
Sorry. Yeah, I don't want to take time from you guys because it sounds like you're under a lot of stress, and I'm so sorry. I just wanted to say that, thank you. But I love what you were saying about early treatment. I do think that is being censored. I see that, and I've read a lot about this now because what are you going to do? For me, here's a good example. Okay, I have 1 dose. Am I considered fully vaccinated? No, I'm considered nothing, which is insane. How is that a thing, right? And I thought that when I went to get my vaccine that I thought someone would follow up, and when I had this reaction, I thought I could call someone. Well, there's no email for me to call. There's no place for me to contact someone. No one to tell me if I should take a second dose. And then when we found out it affected my heart, among other things, my provider said, thank God you didn't get the second dose. But I made that decision myself with no assistance. No one's called me from the Minnesota Department of Health. No one's done anything. So then I have gotten my antibodies tested 3 times. Twice with the spike protein at 4 months out, and then I sent it to a friend I happen to have at the Mayo Clinic who works in vaccinology, And he said, you look like you hyperreacted to the vaccine because your antibodies are very high, like probably too high for someone who had 1 dose. And then I just had neutralizing antibodies done, and I have them, like high. But it doesn't matter. I'm still this 1 dose. I've got this card of nothing, and I don't understand why we're not testing antibodies everywhere, testing natural. I mean, I would love to. I mean, I don't want to get COVID because I was at risk as an immune-compromised person, but if you had it, you're good. Like, you're at risk if you take the vaccine. So I don't understand why our eggs are all in this one basket, or we're on this one train going one direction. Like, why don't we have other things going on all at the same time? I know it's money. Money makes the world go crazy, whatever. Okay.
Well, let me hop in here. At least I know you've been waiting for a while, so you can ignore me again too. So, like I said last time, you guys are in the scientific field, right? And these terms get thrown around all the time, follow the science, follow the data. So are these mandates following the science and the data? And of course, if not, well, are they gonna help?
The political science, not the actual science.
The mandates are definitely not scientifically based. And it's hard because I feel like upper end politicians and head honchos in the country are really controlling or trying to control what hospital physicians are saying and doing, what they're diagnosing you with. Because hospitals are simply worried they're not going to get enough money from the government otherwise. I mean, they get better pay if you're diagnosed with COVID. And it's like there's too much. I mean, what else can we do as a country to be able to get the truth out there?
Let me ask you a question then, because you guys are in the field and I'm not. So, but as a lay person hearing this, that politicians, powerful people are telling doctors what to do. How does that flow? I mean, how does that top-down information flow? Because I've heard it from before, from people saying, no, we follow our protocol. That's what we do here, period. So where do these orders come from? How does this happen?
And I've kind of learned more of it through connections I have with the same perspective I have for medical freedom, as opposed to hearing it from the head honchos kind of thing. Maybe you can expand more on that?
I don't know. What I do know is that that government entities are threatening hospitals and physicians, et cetera, with cutting their funding if they don't force the mandate.
Taking their license.
Right.
They're threatening licensing?
Yes.
Really? Wow, I had not heard that. Wow, okay.
So yeah, there are physicians who are licensed are being threatened that are refusing to prescribe different medications because their license will get flagged. And even physicians that have prescribed medications, or in the past, there's pharmacies that are unwilling to fill it. And so yeah, and also for exemptions. I have heard from multiple people that there's been top-down communication to physicians that they are not allowed to write medical exemptions. So if you are, for example, that lady had talked about how her physician said, oh, thank God you didn't get the second dose. That is a patient-physician relationship.
Yep.
Okay, this has always been a patient-physician relationship. Since when is my doctor not allowed to assist me in making informed medical decisions? And the other thing we have to remember is that everyone's human. Okay, there's a way that you practice medicine. It's called practicing medicine because they're practicing. There are multiple opinions. That's why you have the right to get a second opinion. And so people aren't always going to all agree on the same thing. That's why we're supposed to have the healthcare system that we have about informed consent and patient rights and parental rights. And so I think one of the biggest misconceptions is that and I don't want to bash doctors at all. I love doctors. I've worked with many, many really good doctors. But to say that listen to your doctor. Well, guess what? Some of your doctors are bought, and some of your doctors are getting all of this pressure that their license is at risk, and some of them aren't willing to aren't willing to go past that and quote unquote do the right thing because it means their livelihood, which is what all of us are being pushed to.
Right.
What all of us are being pushed to. And so I think the biggest misconception is that everybody says, well, listen to the doctors, listen to the doctor. 98% of doctors at this facility are vaccinated, so it must be a good idea. But they're not aware of all of the other outside pressures that they have. We know a few physicians who aren't vaccinated and are very for medical freedom, but they're too scared to even show up to one of these. And so that's a big deal. That's a big deal, and that's a safety concern. That is something that everybody in the community should be very concerned about. And I think you had hit it on the nail on the head about the early treatment. The other misconception is that people think, like, number one, all of the unvaccinated people are filling up all the beds, getting COVID and filling up all the beds, and that if you get COVID, that they're treating you to try to save your life. And, you know, Ashley can speak to that, but we know that there are protocols that are working, and they're not the ones that are being used in the hospital. And I, even working in OB, had witnessed ridiculous policies that we have never, just because a virus is novel and new, doesn't mean we throw out everything we know about infection disease, doesn't mean we throw out everything we know about preventing viral spread, you know, about respiratory issues and how we treat patients. We were doing things like, for example, we wanted to prevent aerosolization of the virus. So we were really low on PPE. Everybody's concerned about getting it. Everybody's, you know, scared to death. And so they weren't doing the right things for patients because it would be an aerosolizing procedure. Okay? So that's a big deal. So they were allowing patients to die because the staff were scared that it was going to aerosolize, and so they were putting all these policies in place to try to protect the staff. The staffing shortages we talked about on the way here. If you just had a sniffle and you called in, you were put on leave for 2 weeks. You know, all through COVID and stuff. So we've been working short-staffed all through COVID because they were taking all of our staff out. Anytime you got an exposure, you got taken out. Instead of getting people proper PPE, having them supported as they are, and like actually doing infection control measures as we should be, we wouldn't be in this position. And if we were treating people early with the protocols that work, like from the FLCCC showed 86% decrease in hospitalization and decrease in death rate from using their protocols that are not being used in the vast majority of
What is the
hospitals.
FLCCC?
The Frontline Critical Care COVID Alliance.
Okay.
And yes, ivermectin. Yes, ivermectin. Okay, so it just is. So that's the misconception that I want to bring up, is that they think that people are getting the best care and that they're getting all of the things that is going to help them, and they're not. People are going to the hospital to die.
Yeah. So that final point. So. There's a reason that we aren't asking anybody to introduce themselves. There's a reason nobody really knows where we are unless they recognize this room. There's a reason we changed the location last time. It's because it takes courage, and you guys have it, to show up and have these conversations. And when we were leaving last time, somebody who's in this room again, who I won't credit this quote to, said something to me that was just hit me hard. And she said, and again, if anybody wants to talk about this, please feel free. But they said, if you have COVID, one of the worst places to go would be the hospital. And I just got blown away by that, and I went, oh my gosh. Like, if we do this again, we have to talk about that. And I'm shocked that so many people are saying yes, because nobody in the public, I guarantee, is at home watching this going, oh, that just makes it so nonsensical to say if you're sick, if you go to the hospital and you have COVID, then that's like the worst place to be. But, sorry.
So I'll just touch on that a little bit. So if anybody had previously before COVID, if anybody had a respiratory illness, they would treat it totally different than what they're treating it right now. They would make their patients, if you're in the hospital, they'd make them get up and walk, they'd make them do breathing treatments, they would do breathing exercises, they would pre-treat them for a bacterial infection. All of these things are not getting done with a respiratory illness. So they're not treating patients like we have for years when it comes to respiratory. We are putting them in a bed, making them lay there and not move. A person in a bed is dead. I'm sorry, but you get them up, you move them. So that's one thing that people are going to the hospital and getting put in beds. And at the beginning, it was the scare tactic and it was the fear mongering. And they weren't even going into the rooms to these patients for hours. And so they're just laying there. You can't get healthy or back, especially with respiratory, by laying in a bed. So, and the protocols that they initiate in the hospital, you do not step out of them or you don't get funding. So you just do it. So if it doesn't work for you, too bad. So treatment is
is not okay.
Well, we've got about 5 minutes, and I know a lot of you guys drove like 100 miles, so I want to be very respectful of your time. I said it'd be about an hour, so I just want to make sure we're staying on track.
Just one really quick. The other thing to remember is that these people don't have these patients don't have family members that are there advocating for them. That is the other thing you guys have to be very concerned
Because they're not
about.
allowed, or what?
I mean, there's been visitor restrictions all through COVID, and it's just going to get worse. You think that, you know, this fall and winter that it's going to get better? It's going to get worse. That's the other misconception, is that this vaccine is what is going to fix everything.
So that's the last question. That's the last question I have.
So
is
if the
what-
vaccine works so well, then why are we still having flare-ups? Why are we still having spikes in COVID? If we've got 60 to 70% of people in this country with at least one shot, then why are we still having these go up? Shouldn't the numbers be going down? Shouldn't that in and of itself be showing that this vaccine is a crock of crap right now? I mean, seriously.
So that kind of brings me to the last question, and this, I really want you guys to talk about this, because in your opinion, what would help us defeat COVID? Is there defeating COVID? Oh, sorry, somebody with the microphone. There's a lot of opinions there.
Politicians out of our medical care.
Oh my gosh, somebody say that in a microphone.
Okay, so we're going to get the politicians doing their job, which is not treating patients. My concerns are...
Please clap for that.
I would like to know, first of all, because I have done home care and I have worked for these wonderful folks, I know what it takes to get someone home to recover. They need assistance. This is changing the face of home care. There are not going to be nurses. Families are going to be home caring for folks. When do we go from being the heroes who get the bonuses to the poor saps who get the boot? That's where we're at, folks. And our families at home are going to pay the price. That's how that's how Medicaid, these things being withheld from providers are going to change the face of health care. It's not going to be there. Do you have anything, Liz, you want to add?
Go ahead.
Go, Liz. Go, Liz, go.
This has been a really hot topic for me. With my company, I do not want anybody to put anything in the body they do not want. To me, I've done a lot of research. I've done it with another doctor off to the side, and it scares me. It really, really scares me to know some of the things that are in this vaccination that is scaring me, and I don't want to say. I'll talk to whoever after over it. Our company means a lot to us. Our employees mean a lot to us. Our clients mean a lot to us, and I'm trying to protect them all. And the state is really scaring us.
One of the things, Eric, in answer to your question, what can we do to change COVID? First off, we need to change the narrative and get the truth out and quit censoring and suppressing the truth so the general public can know the truth that there are effective treatments and the whole truth about this. This can be done very simply and get the politics out of it.
That's awesome.
In a sense.
Thank you for that, because that is fundamentally why we're here, is to get these truths out. So the people watching this, please, share this thing. We've got to continue to get these messages out.
Okay, I'll probably be recognized by a couple nurses at Abbott, but needless to say, I just want to actually add that, we talk about early treatment. I work in an ED and I work in an ICU as care coordination. And the thing that actually bothers me so much is right now they're actually doing a study, and I just conferred with another pharmacist at a different facility. And the study is at the University of Minnesota. Can I read what they actually say here? Okay, here we go. COVID-19 increases inflammation in the body, which causes harm. The medications metformin, ivermectin, and fluvoxamine are known to decrease inflammatory proteins, cytokines in the body. They also appear to possibly stop the proteins inside cells that help viruses reproduce and spread. Next point, reviews of persons who develop COVID-19 while taking metformin suggest they were less likely to be hospitalized or die from the infection. Smaller prospective studies showed patients giving fluvoxamine or ivermectin were similarly less likely to be hospitalized or die from COVID-19. Last point, if we give metformin, ivermectin, fluvoxamine, or a combination of these medications to individuals soon after they develop COVID-19, will it decrease the severity of their symptoms? Although they just said that it would. Okay. Will it prevent them from needing hospitalization? Yes, it just said that they would. This study hopes to answer these questions. So I guess the thing that I'm saying is exactly what all of these people are saying, is that I had ICU nurses actually make fun of ivermectin. I've had doctors making fun of ivermectin and other options. So I'm sure everybody, I've never gotten COVID. I have actually followed all PPE guidelines. I am not getting the vaccine, and great, hey guys, yo, not getting it. So just on that scope, how we end COVID, honestly, follow what other countries are doing that are working, okay? They have less technology than we do, and they're having better outcomes, okay? The Taliban's running around Afghanistan, they're not worried about COVID, okay? And we gave them a lot of money, $85 billion worth of stuff. Anyways, but last but not least that I just want to mention as well, and this is just truly the process of, and I work in pharmaceutical research as well. I have done it for almost 20, 25 years, so it's not like I'm, some wet behind the ears person. And when I saw the actual approval by the FDA for the Pfizer vaccine, I was absolutely floored. Because it did not complete the trials the way that it was supposed to complete the trials. It actually, and this is the thing that really bothers me, is they extended the emergency use authorization of the Pfizer vaccine that is being given right now. Renamed it, but then it's not marketing until 2023. So the one that they approved is not even on market. It is not what you're getting. And so isn't that something? But when I actually try to bring that up to people, oh, whatever, just get vaccinated. Well, let's just do this. Let's just try the actual cheap thing and just treat the patients. Just treat the patients. That's it.
That's not done enough. I think a big question everybody who's been called a conspiracy theorist has, why? It's just why. Why are doctors being silenced? Who is at the very tip of the spear causing everybody to just cower to this? If there is 80 to 100 million Americans not willing to get it, and so many of them are educated, they're medical professionals. You don't have to be a medical professional to question this. If we're willing to step out of something we worked so hard for and we've done so much training for and we love as a career, we are willing to give it all up to protect ourselves. Why is it being pushed so hard? Why are more people not questioning it? And I even have a coworker, and she got the vaccine, and she said to me, I got the vaccine because we worked through COVID. I thought it was the right thing to do. I'm not going to vaccinate my kids. She said, but I'm really sick of people thinking I'm an idiot with how viruses work, how the PPE is supposed to work, and to make me think that all of it's gone out the window for COVID. Because she said we've had enough training, we're critical care, and the people who seem to not be on that same wavelength, who want to continue the fear, which like I said, I'm on a great floor, there's not very many, are the ones who wanted all the recognition in their PPE on their Facebook page. They want to continue the fear-mongering so you can continue to call them a hero. And I'm a little bit different than a lot of people. I truly feel like a hero is somebody who serves your country and puts your life on the line. And I feel like what we do every day is just our job. It's just what we're supposed to do. I've pushed away that hero status the entire time. It actually has made me roll my eyes and kind of like get in disagreements about it at work with people. But I think the people who loved that recognition and they want to continue that recognition are also trying to continue the fear so you continue to recognize them. So they'll push away everything they're actually seeing in practice just so they can continue. They've got that. They've got their 15 minutes. They want to extend it for another 4 hours. That's what I'm seeing.
Right, at the expense of everybody else. Well, that puts us at an hour, everybody. I know we could go for all night long, but an announcement about what? Oh, yeah, good thinking. So people that are out there wondering what can they do, how do they get involved, there's so many ways to get involved in this fight to stop vaccine mandates. So there is a rally this Sunday at the Minnesota State Capitol in St. Paul from 4 to 7 p.m. I think the last one had about 5,000 people there. I'm thinking this one's going to be bigger than that one because the energy is only greater. And since the last one, Biden has come down and said a national vaccine mandate. So yeah, definitely go out to the Capitol this Sunday, 4 to 7 in St. Paul, and join us. So, and then share this, please, because as everybody here said, we have to get the truth out. That's how we start to kind of win this battle. So share this video on all the social media platforms. And thank you again, everybody here, for coming out. Give yourselves a round of applause. Thank you, because it takes some guts to come out and do it.